And in the sphenoid bone, we have some wings. This is a greater wing here. We can see the greater wing in the whole skull as well. Here in the middle cranial fossa, we can see the greater wing. Here on the lateral surface of the skull, we can see the greater wing, especially if someone colors it red. And then in the orbit, we can see the greater wing. So if you look at it, it's kind of a pyramidal shaped process coming off of the sphenoid bone. So that's the greater wing. The lesser wing on top, running over the top of the superior orbital fissure. Okay, you see the wing-like, almost bat-like shape of it. Also, it is covering over the top of this opening. That is the optic canal that is coming out forward into the orbit. Other structures that we can see coming into this area we call the pterygopalatine fossa. This is the foramen rotundum, the round foramen. And then back behind that is an oval-shaped foramen, the foramen ovale. All of the cranial nerve branches, once again, are divisions, go through openings in the sphenoid bone. This area on the top of the sphenoid bone here, that's where the pituitary sits. It's called the sella turcica, the Turkish saddle.
You didn't catch it.
On the inferior aspect of the sphenoid bone, here in the anterior aspect, there's a protrusion, which is going to articulate with the back of the ethmoid bone and the back of the boma. This is called the rostrum, the nose of the sphenoid bone. Okay? And then alongside of the rostrum, once again, we can see an opening here. That's the foramen rotundum. And then there is another opening just medial to the foramen rotundum that we haven't talked about yet. This is the anterior aspect of a canal called the pterygoid canal, the Vidian canal. Okay. And that is where a combination nerve goes through, a combination of the postganglionic sympathetics called the deep petrosal nerve and the greater petrosal nerve that form this nerve called the nerve of the Vidian canal. These structures coming down here are lateral and medial pterygoid plates, which are extensions of the sphenoid bone inferiorly. In the back of the sphenoid bone, we can see this region here, this pterygoid fossa area here, with the lateral plate and the medial plate, creating its medial and lateral borders. But at the top of this, once again in the back, is the posterior extent of this pterygoid canal. So if we pass this pipe cleaner through, we can see that it goes through the front and the back of this pterygoid canal. We'll talk about this more when we get deeper into the head. Okay. Here we've got a bone that I think you're well aware of. That's an adult maxilla. And look at this little guy. What do you think this is? Is this an adult? Okay. And is there just one bone here or are there two bones? Okay, right, there's two bones here. Here's the zygoma with a zygomaticofacial foramen, and here's a maxilla. This is a deciduous, these are deciduous teeth. The deciduous second molar hadn't erupted yet. The deciduous first molar had erupted, and we've got the deciduous first and second molars are here. The canine tooth is here, but the central and lateral were broken off. The permanent first molar has yet to come out of its crypt. So approximately how old was this individual, this child, at the age of its death? How old? 5? Could have been 5. That would have been at the latest extent. Okay, because if the first molar had been erupted, then it would probably be at least 6. So, but it's probably somewhere between 2 and 5. Okay, because very little formation of the molar at this point in time. So that wasn't ready to erupt at any time soon. Okay, in relationship. Okay, we've got this little guy here. I think we got a pair of these. See if we can find the other one.
So what's that screen? My head hurts looking up, so it's better if I look
Okay, what do you think these bones are?
Oh yeah, that's what I got.
Okay, these are palatine bones.
Oh,
This is the back of the palatine bone. This is called the posterior nasal spine. Back here, this pointed process. Let's see if I can make fingers out of it. I don't know if I can. Okay, back here. And then this anterior aspect is where it articulates with the maxilla and also with the pterygoid plates of the sphenoid bone. And then this little process up here on top is called the orbital process. We'll see when we talk about the orbit that one of the bones that helps form the orbital chamber is the orbital process of the palatine bone, and that's this portion right here, sticking out. These actually are not real bones. These are actually some type of plastic alloy.
no. What?
Okay, we have some inferior concha here. Okay, for your benefit in terms of identifying them, unless we get another set, these are both left. Okay, there is a lip of bone that comes over laterally to articulate the maxilla. I told you from the standpoint of the shape of this bone, it kind of looks like a sailfish to me. What it looks like to you, I can't tell you. Okay, so this is the front, this kind of bulbous portion out here. Let's see if we can zoom in on this. Okay, this is the front, the anterior portion. This pointed portion is the posterior aspect of the inferior concha. And this lip of bone over the side is a lateral process that articulates with the maxilla. Here we have a zygoma. Okay, with its frontal process here, its zygomatic process here, and its maxillary process here. And this has a zygomaticofacial foramen coming through it right here. Okay, looking at a couple other bones, then we'll look at these foramen in the whole skull. What's that bone? What do you think that bone is? Someone said hyoid bone. Okay, not an infant mandible. This is the hyoid bone. This is its body. This is its greater horn. The lesser horns are at the corners. This is actually real bone. This is real hyoid. These bones right here. These are nasal bones. The wider portion of the nasal bone is down its inferior aspect, which is down here. This bulbous portion articulates with the frontal bone up here, and the lateral border articulates with the maxillary process, the frontal process of the maxilla up here. Okay, so these bones are in this bone box, both this large bone box and the small bone box. The bone boxes are in the laboratory in a cabinet that's labeled bone box. What a funny name. So you can look at those bones in the laboratory, okay, but you can't take that box out of the laboratory. Okay. Replacing a skull is expensive enough. Replacing a bone box is about $3,000. Okay. So I know you pay a lot for tuition. You really don't want anything else on your statement as you're going on. So be sure that and also from the perspective that these are things that you're sharing as learning tools. So be respectful to your classmates from that aspect. The large bone box, the same thing. All of these large bones are in there, so just use it when you're in the laboratory. The skulls on the glass cabinet in the laboratory that is above